because I get to talk about a real leader in Chicago healthcare. I'm here to present the award to our executive director. Now, some organizations make it a habit to present awards to each other. We really don't do that in health medicine. So it's relative, it's very rare that we present an award to one of our own. And you can read your programs Margie's bio, but so many in this audience know Margie from a number of different venues. We don't really care in Chicago that she got educated in St. Louis. Her kids may care, but we don't care. We know that she began to get interested in health issues in college. But if you're like many people on our board, like me, that understands that public health is really everything, that never surprises us about college students. Everything college students are interested in is really about health. And while Margie cut her teeth helping set up community health centers and was active in the women's movement, and especially the women's health movement, she really first began to function with health medicine as a board member. And then in 1986, as the vice president of the board. And what we're really honoring tonight, for the past 18 years, has served as the executive director of health medicine. Now, you know, Quentin and John used words, even Richard mentioned, used words to explain how health medicine is different. And if you don't come to board meetings, it really can go over your head. You know, so we say polite things like, health and medicine has no constituents. That means we have no members. That's what it means. Health and medicine has a working board. What that means is that we expect board members to actually do stuff. And if you know our board members and our past board members, you know, this is an odd board. We really do not do what boards are supposed to do. Tonight is an unusual exception. For example, one of the first things boards are supposed to do, which our development person keeps telling me, is raise money. We don't do that very well. We try to celebrate people's birthday every other year, but other than that, we're sort of bad. And Richard and Lon, always our health planners, tell me that boards are supposed to set strategic direction. But if you don't have a constituency, I don't know what you're setting strategic direction for. So we have trouble with that. So even though we have these retreats and we say we're going to do this, this, and this, we do whatever the hell we want. To be on our board, you don't just have to be able to be active, you have to be very opinionated. That means that, unfortunately, we have a lot of different opinions. Can you imagine working for such an unruly group? We make rules and we break them every month. So for 18 years, Margie Schaps has been able to come into that office and work with a bunch of crazy, opinionated, loud-mouthed, dedicated, and hard-working people. It's worse than herding cats. And whether we're addressing long-term care issues and looking at economic security for our elders, whether we are worried about court-involved youth and breaking ground in coalitions there, whether after 20 years, let's start with the chief executive, we finally achieved as the government freestanding birth inspire staff, and protect them from the board so they don't get confused, right? Some staff is not. And really create an organizational aura for health and medicine that has really the secret to our success. So today in the city of Chicago, when a new man comes in from New York, the real second city, we won't tell them that, and faces an impossible task, who does he call to meet with? When there's a question about how to approach not-for-profit hospitals that act as though they're for-profit hospitals, who do you call? If you have a contentious health issue and you want to bring people with different opinions into the same room so that you can have a civil conversation, who do you call? That's exactly who you call. You call Margie. Her real contribution is that she functions as a thoughtful, inspired leader in our community around health issues. That she not only has her pulse on what's going on in healthcare in the nation, in the country, but she brings it to work every day. And she's able to take our staff and coordinate their work. And probably her greatest contribution is how she inspires and mentors all of the many students that come through